Hey guys, welcome back to my channel. My name is Venitra. In today's video, I want to discuss swelling after plastic surgery. So for those who do not know, I am a licensed esthetician and I am a post-operative specialist. So 95% of my business is post-operative care, meaning that I work with women who've had plastic surgery. So first things first, a lot of what I am hearing and dealing with within my treatment room right now is swelling. And I wanted to make this video because I feel that it is very, very important for you guys to understand why are you swelling. To instead of going into these different groups and you got one person who has one round of surgery, now they trying to tell everybody in the group how things are supposed to go, and that's just not right. It's not logical, it's not ethical. And as a professional in the field, I feel that it's my job to come to y'all with the real. So I've seen well over almost 1,000 girls. I've been doing post-op for almost 2 years at this point. And the one thing that I do notice is that swelling is one of the main issues that you have after plastic surgery. So let's get into why you are swelling and the science behind what's going on. So when you first have liposuction, what happens is when the doctor removes the fat out of the subcutaneous layer, it leaves a gap within your tissue, your skin, and everything else. And so in order for that to start healing, the body sends as its own protection mechanism fluid, right? So this fluid is why you come to see me, to make sure that it's not accumulating to the point where you get like a seroma and you start dealing with different health issues due to your lymphatic system being congested. So a few reasons of why you are swelling is one, because of surgery. If the doctor removed all of the fat out of your trunk area, your stomach, your abdomen, your flanks, your back, that is true trauma to the body. So the body is going to send fluid in order to try to protect the injured area. Two, so now that we understand why we have fluid, let's get into some ways to decrease the amount of fluid retention that we have. So one, wearing your faja. I see a lot of girls who don't really want to wear their faja. What if I wear my faja 3 hours out the day and then the rest I do a waist trainer? No, if you are not 12 weeks post-op, you should not be thinking about wearing nothing but your faja. You may need to get a few different fajas to make sure that that you're comfortable, but getting out of your faja is an absolute no. Okay, the reason why you need to wear your faja is because one, it sculpts the body. Two, it decreases fluid retention. And three, it helps mold everything so that it comes out the way that it's supposed to come out. If you had a BBL, right, in order for that bottom part to not swell and to cause you issues and to really shape you a nice little plump booty, right, we have to wear our faja. Okay, so number two, salt intake. If you are eating anything with salt, stop now. That is probably the main issue. I know that you from the country or you like your food, seasoned and all of that. I get it. But during this healing process, we have to have a much cleaner diet. We have to increase our water intake. We have to decrease our sodium intake. A few things that you could use to help move your lymphatic system along is one, lymphatic drops, but my favorite is dandelion tea. Dandelion tea works directly with your lymphatic system to help remove toxins. And so all of my ladies who I recommend dandelion tea to, they come back and they're like, best thing ever. So yes, it may have you getting up in the middle of the night going to the bathroom, but we want to get as much fluid out of you as possible. Another thing that I see a lot of people doing is, let's talk about reopening of incisions in order to get the fluid out. So incision is called incisional draining. It's usually happens within the first week, right? So anything after 7 days, you're running a chance of an infection. And for the people who are doing it, you want to make sure that your person knows exactly what they're doing and that their utensils are sterile. Um, this is such a controversial type situation that I don't even like to really talk about incisional draining. But the reality of the situation is that some people may need to be incisionally drained. Some people may need to have a seroma drain where we utilize a needle and we puncture the seroma and we drain it out. All of that is up to you of the person that you choose to do it. But just make sure that your people know what they're doing, right? So you as the client, it is your due diligence to make sure that your post-operative person is what they need to be. It is your due diligence to make sure that your surgeon is who they need to be. Me personally, I feel like you need to have an intuitive connection with your surgeon and your post-op person. Stop getting in the groups talking about, oh, this my body type, who y'all think I need to go to. No, do your own research at all times. Do not allow other people to dictate what you're doing, who you're going to, and none of that, right? So that's just a whole nother situation, okay? But back to the swelling. In order for you to decrease your amount of swelling, it takes everything as a whole. It's your compressions, it's your water intake, it's your food, it's your stress level. How long are you on your feet? When did you start back working? How aggressive was your surgeon? It is so many things that determine your overall recovery process. And I think that it's imperative that you understand that you have to do the research. And I know everybody is ready to be bad, right? So you want to get to where you going much faster. But for me, it's slow but steady. You get what I'm saying? Like, let's heal. Let's do the things that needs to be done. Let's be consistent with our massages, right? I understand everybody in the group, oh, what do I need to do about massages? Do I really need massages? The whole point of your massages, okay, let's get into it. The whole point of why you're getting massages is to make sure that your tissue and your skin comes back together without fluid in between that then leaves protein and causes fibrosis. You need your massages. Period. Now, how many you want to get is strictly dependent upon you. Every doctor that I know recommends at least 10. As a post-op specialist, I know that you're going to need anywhere between maybe 20 to 50 massages through this whole recovery process. No, it's not 20 to 50, boom, 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 back to back. No, what I'm saying is 20 to 50 within this first year of recovery. If you cannot afford to keep your recovery up for a year, my suggestion as a post-operative specialist who sees hundreds of girls, do not get your surgery right now. If you cannot afford everything to have the best outcome, don't do it. Save your money, continue to stack, and then when it's time, go ahead and do that. All right. So once again, my name is Venitra. I'm your post-op specialist. I am the owner of Ego Aesthetics, located here in Conyers, Georgia, where we service women who have had plastic surgeries. Our specialization is really tummy tucks. We get a lot of tummy tucks. I mean, I get a lot of BBLs and Lipo 360 as well, but tummy tucks just take a little more, tender loving care. And so those are the things that I focus on, because my main goal in my practice is to make sure that you make it back home to your family in the best headspace and physical space as possible. I am here to support each and every one of you guys. So if you have any questions, go ahead and leave a comment below and I will be sure to get back to you. Like I always say, make sure you like, comment, and subscribe. And I would definitely be releasing more information when it comes to post-operative care, because I just see so many issues in these groups. And I'm just like, girl, no, that is the wrong advice. I see people just giving out the wrong advice who really do not know. Just because you had surgery does not make you the GOAT when it comes to post-op, and for you to be telling other people how to handle what they did. Now, you could tell them what you did, and it's up to them to, you know, do what you said you did. But for the most part, like, always redirect them to their surgeon and to the people that they are paying to help them with their post-operative care. It's been real. It's your girl. Holla at me.